So with that, let me introduce our last speaker. Katie Tejado is here to talk about speech and swallowing. She is a graduate from the University of Wisconsin-Whitewater in 2014 with a Master of Science in Speech, Language, and Pathology. She has worked with Aurora Healthcare for 5 years as an inpatient and outpatient speech-language pathologist. Her clinical interests include adults with neurological disorders such as Parkinson's disease, stroke, and traumatic brain injury. She also works with pediatrics with communication delays and disorders. She is certified in the LSVT Loud program and takes special interest in working with patients with Parkinson's disease. So when we get Katie up here, she is 8.5 months pregnant?
Ish.
So the good news, she said the baby's not coming in the next hour. But I'm not a person who takes chances, so I'm going to go find a nurse, and I'll be back in an hour. So let's give Katie a round of applause.
All right. All right, so hello everyone. So I'm Katie. If I just hit this, does it go on? Oh, perfect. All right, so as Jeremy said, I'm a speech therapist. I work at Aurora Medical Center in Summit off the freeway in Oconomowoc. I do primarily outpatient therapy, run some of the Parkinson's exercise classes there as well, and then do the LSVT Loud program, if any of you have heard of that. So today I want to talk to you guys about the common changes that you might notice with speech as well as swallowing with Parkinson's disease. And then we'll go through some tips to improve or maintain your function in those areas and kind of what you can do about these changes. So we'll start with going through the speech aspect of things, although you'll probably notice there's going to be a lot of overlap with the muscles that we use for speaking as well as the muscles that we use for swallowing. So to kind of go through some terminology with everyone, the medical term for difficulty with speaking, dysarthria. And this is a neurological speech disorder. This is not only caused by Parkinson's disease, it can be with any neurological condition. People can have these changes in their speaking. So it's caused by muscle weakness, changes in range of motion, movement in the muscles used for speaking. So our tongue, our jaw, lips, even the vocal cords, any changes in those muscles can lead to issues with speaking, which then leaves that perception for others to kind of hear almost like a slurred speech. So then there are many subtypes as well of dysarthria. So, do you have a new mic? No, not at all. All right, so the subtype of dysarthria that is really common in Parkinson's disease is called hypokinetic dysarthria. So hypo meaning reduced, kinetic meaning movement, and this is due to a deficiency of dopamine in the basal ganglia that causes this. It can and leads to increased muscle rigidity, tremor, that slow rate of movement of the tongue, lips, and palate, and then that decreased range of movement, difficulty starting and stopping. So you might notice with walking, you have those freezing episodes, difficulty starting and stopping. That can happen with speech as well, so difficulty initiating speech, where you get frozen, or once you start talking, difficulty stopping that movement, so almost comes out as like a stutter. That masked or expressionless face is common, and then bowing or weakness of the vocal cords as well. So what I want to have everyone do as just a little speech exercise is I want everyone to say the word buttercup, and you're going to say it 5 times as quickly but as accurately as you can. And as we're doing this, I want everyone to think about how their muscles are moving in their mouth, what your tongue is doing, what your lips are doing, how your voice is working, just to kind of give you an example of kind of how our muscles work. So on the count of 3, I want everyone to say buttercup, 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 buttercup 5 times. So 1, 2, 3. Buttercup. All right. So did everyone kind of think about how the muscles were moving and notice anything that was going on in your tongue or lips or anything like that? When we're saying just that one word, buttercup, there's a lot going on. So our lips have to come together to make that B sound. Your tongue comes up to the roof of your mouth when you're saying the T sound. The K sound in cup, your tongue comes back to kind of the back of your throat. Then your lips come together again at the end with cup. Your voice is turning on and off. Some of the consonants that we say are voiced, some of them are not. So we're using a lot of muscles, and there's a lot going on, a series of complex movements of the muscles when we speak. So you can imagine if you're having any breakdown in the muscle movement, in those muscles we use for speech, that it won't come out as clear. So if we're having reduced coordination, reduced range of motion, issues with our voice or vocal cords, then those movements won't be as precise. The speech won't be as clear. Changes in the voice, you won't be able to project as well when you're speaking either. So the common characteristics of speech due to all of these changes in the muscle movement are that reduced loudness. That's one of the really common ones, is that quieter voice. You can get a hoarse voice quality, being monotone, so kind of that flat affect and kind of flat pitch. And then imprecise articulation, so meaning like kind of that slurred speech. Vocal tremor, so just like you might notice tremor in your hand, you can actually get a tremor of the vocal cords as well, and then you might hear that in your voice when you're talking. And then, like I said before, that difficulty with initiating or stopping speech, so maybe getting frozen and stuck on a word or stuttering. And some patients report that volume, hoarse voice, or monotone pitch as their first Parkinson's symptoms. So I wanted to talk to everyone too about some cognitive changes that you might notice with Parkinson's disease. So these are, even though this isn't directly related to the muscles in your speech or your speech directly, it definitely can also impact your ability to communicate. So it's something important to consider as well. So changes in cognition or like your thinking skills that you might notice or that can happen with Parkinson's disease include slower processing time, so just taking extra time to kind of process what someone is saying to you, or even like if you're watching a movie or TV show, kind of keeping up and following along, that processing speed. Word retrieval difficulty, so kind of feeling like the word might be on the tip of your tongue, having a hard time coming up with the word that you want to say. And then memory impairments too, so difficulty with recall or remembering names or things can also impact that. So with these changes, It might lead to difficulty keeping up with a conversation, especially in a group setting. So, conversation tends to be really fast-paced. There's a lot of topic changing and sometimes people talking all at the same time and quickly. So these changes can kind of lead to sometimes people becoming a little bit socially isolated and feeling like they're left out of the conversation because they don't get a chance to kind of get their word in, and especially those group situations. So to talk to you, so now that kind of covered the changes that you might notice in speech or communication with Parkinson's disease. So now I want to go through sort of how it's treated or what we can do about it. So getting evaluated by a speech-language pathologist is kind of the first step. So what a speech-language pathologist does in their evaluation would be kind of gathering your history, seeing how far along you are in the disease, what exactly are you having difficulty with, assessing your speech and voice, doing a variety of different measures of where you're at, having you do different speech tasks, voice tasks, and then kind of determine a severity. So some people might notice just mild changes in their speech. Some people who might be further progressed in the disease might have more significant changes in their speech, and also depending if you've never had any therapy before or maybe you have, there can be a lot of variety in kind of how someone is presenting. And then, so we'll get a baseline measurement, kind of see where you're at, and then trial different cueing techniques, see if there's things that can help to improve your speech or voice, and then that can kind of determine if we feel you'll benefit from therapy, and then we can determine some goals and a treatment plan based on your individual needs. So this is something you guys all have a copy of on your table. It is called the Communicative Effectiveness Survey. And this is just an example of something that we might use in an evaluation as sort of a self-rating scale to see how much your speech is impacting your day-to-day function and day-to-day communication. So feel free to look through it, and if you feel like filling it out, it might kind of help bring your awareness of how much, if any, of your speech is affected and how much it's affecting your communication. So the rating scale 4 is that your speech is very effective in a specific communication situation. 1 being that your speech does not allow you to communicate at all in that situation, or you can rate anywhere in the range kind of in between. So that's kind of all of the sort of the evaluation process. So then what I want to go through next is some different treatment options that we might consider when treating someone who has dysarthria or that speech disorder. So LSVT loud is sort of the gold standard treatment for speech and voice in Parkinson's disease. So this program it has Parkinson-specific exercises. It's a protocol. It's 4 times a week for 4 weeks. It's 60-minute sessions. It focuses on kind of just a single cue of being louder. This can be really helpful, especially if someone is having changes in their memory or things like that, and it's hard to kind of retain new information and be able to kind of respond to multiple different cues of having to think about the breathing and having to think about your rate and having to think about all of these things. It's really just kind of this simple cue of just talk louder. So that can be really helpful because it reduces that cognitive load that sometimes therapy can have to help with retention. So the idea behind this intensive repetitive therapy, the 4 times a week for 4 weeks, giving you guys daily kind of homework assignments, is that repetition is what really drives motor learning. So in order to get better at a skill and to make it become more automatic, we really need to do lots and lots and lots of repetitions of it. So it's just like anything you learn how to do. You want to get really good at it. You want to learn how to play the piano. You're going to play it over and over again until it becomes kind of like motor memory. So it's the same concept. So it's those principles of motor learning. Over and over, we repeat the same similar exercises to try to make it more automatic. Part of Parkinson's disease is that the pathways in the brain that are affected are those involuntary pathways. So when you're walking and you're talking, kind of doing those everyday automatic tasks, there's a breakdown in how you're able to complete those tasks. The voluntary pathways of the brain are not affected. So that's why we're able to make these improvements, because if you voluntarily and consciously think about what you're doing and think about, I'm going to talk louder, I'm going to do this movement differently, you can override those involuntary pathways. And the more we do that, we kind of retrain the brain to do things in a different way. So in addition to, like I said, we just do that single cue to try to keep it simple of being louder. Research, there's lots of years of research on this program, and research shows that even though we're only working on talking louder and kind of that single symptom, there's a spread of effects. So naturally, when we talk louder, we take a deeper breath, so it can improve breath support. We might, kind of just hit the targets better with the muscles that are moving in our mouth when we're speaking louder, opening our mouth wider, kind of getting those movements better so it can improve your articulation. Facial expression is also shown to be improved, the muscles that are moving in your face. And then swallowing. So like I said before, there's a lot of overlap with those muscles that we use for speech and swallowing. So there can be some improvements in swallowing as well, and that we'll touch on a little bit more later as well. So although I said, the LSVT loud program is sort of our gold standard and recommended treatments, it's lots of research specifically with Parkinson's. I do understand that sometimes people aren't able to do that program, whether it's the time commitment. Sometimes people don't have transportation to bring them that often. Sometimes people have a really high copay on insurance, and it's just going to be too much. So for whatever reason, if the LSVT Loud program specifically doesn't work for someone, we can recommend just general speech therapy. So it's less intensive. So we might just do like 1 to 2 times a week of therapy, give you things to work on in between, and then depending on your specific needs, we'll determine how long you'll need to be seen. So that's also another option, can work on different speech, voicing exercises. We can incorporate family, caregivers, and kind of help do teaching with that as well. So still a beneficial treatment and good option if for whatever reason you wouldn't be able to do the specific loud program. So in addition to kind of that one-on-one training or one-on-one therapy that someone with Parkinson's can go through, there's also things that the communication partner can do to kind of help with the speech and the communication interactions and communication breakdowns that might occur. So whether it's husband or wife or caregiver, there's things that you can do to help the conversation flow a little bit better. So definitely just being patient with your loved ones. So understanding that they might need extra time to get a thought out, or they might need a second to kind of process what you're saying to them, and kind of giving them that extra time, incorporating sort of pauses into the conversation. Making time to set up one-on-one conversations. So a lot of times when people have these changes in their speech and their voice, it might be embarrassing, it might be challenged to talk to people, and so they might kind of stop talking as much and kind of not have as many conversations. And so it's just important to try to encourage that conversation and encourage the talking and using their voice, not only for, working on the speech and the voice, but, your emotional well-being and being able to kind of stay social and participate in conversations. Cueing to talk louder, so that's something, especially when someone's going through the loud program, we might talk to the spouse or whoever is going to be helping the person with the program to cue them when they're at home. Can you talk louder, and kind of give those cues if they need them. And like I said, slowing down the pace of conversation, trying not to interrupt. So especially if someone is trying to formulate a thought and then maybe kind of pausing for a second, trying to think of the word, trying to resist that urge to jump in and fill in the blanks if they're able to kind of just come up with it on their own with some extra time. And then allowing that extra time for the processing and responding. So like I said before, especially in those group situations where a lot of people are talking, a lot of conversations going on, if you can try to, allow that person to get their word in and kind of slow things down and really take time to listen and kind of pause for them to be able to come up with what they want to say. So a big takeaway too, it would be just the importance of staying social and kind of, like I was saying before, that common to become maybe socially isolated and not want to go out and participate in things, maybe out of embarrassment or maybe just having difficulty with talking, so kind of trying to avoid it instead of staying and kind of doing these social things. So some things you can do, especially the Parkinson's groups, can be really good, because that's a good way to, get out and stay social, use your voice, and then you're with, peers that are in the same boat. They can understand maybe what you're going through a little bit better, and you can relate and maybe feel less embarrassed with peers that are going through the same thing. So there's lots of different Parkinson's group options, such as exercise groups or support groups, things like that. Volunteering, just going to social events with friends and family. So there's this use it or lose it kind of philosophy. So it's kind of a slippery slope. If you notice these changes in your voice and that's leading you to try to just avoid conversations and avoid talking, then your vocal cords are going to get even weaker because you're not using them. So then it kind of leads you down that path. So trying to keep using your voice, try to keep talking so you can maintain that function and kind of keep the vocal cords strong and prevent them from becoming weaker and help kind of maintain your function. So kind of to give you something to take away today, what's something you can do today? So I also have a handout for you guys on your tables, I think, or the Dysarthria handout kind of has some of these things written in there on how to improve your speech. But some tips for clear speech: speaking up, so definitely that talking louder, increasing that loudness. Taking a deep breath before you speak and pausing for breaths as needed. So that breathing is a big piece of voice and speech too. So making sure just to try to take breaths as you need them and try not to give a whole story, talk and talk and talk without taking that breath, because your voice will start to get weak or start to get strained, and then you kind of run out of air. So just remembering to breathe as you're talking. Speaking slowly and clearly. So it's common to have kind of that rapid rate of speech. And because those muscles aren't coordinating and moving as well, when you try to talk quickly, then it can become more slurred and difficult to understand. So think about slowing down, allowing those muscles a chance to kind of move where they need to move. So kind of slowing that rate of speech. Saying each word completely. So try not to drop off at the end of the word. Try not to let your voice trail off at the end of a sentence. Make sure you're saying each word completely. Exaggerate or overemphasize sounds and words that are difficult. So kind of like over exaggerating a sound in a word. And then if you are in speech therapy or decide to do speech therapy, to keep up with the exercises provided by the speech therapist. So exercise is very important with Parkinson's disease, and it's not just a 1 month of therapy and you're done. It's kind of that daily practice and ongoing exercise that will help maintain your function. So some other things that you can do. So singing along to the radio, reading out loud. So if you like to read the newspaper in the morning, maybe practice for 5 minutes of reading it out loud. Other things like mail. When you get the mail and you're kind of reading through it, read it out loud. Read through maybe what's on the TV guide. Just different ways you can use your voice. Talking on the phone. So maybe if you have a son or a daughter that doesn't live close by, or a friend that you could call, and try to maybe do that on a consistent basis, so you can practice, using your voice and talking on the phone. Striking up conversations with a stranger, so at the grocery store, maybe chat with the clerk. You see the mailman, talk to the mailman. Maybe neighbors outside, go have a conversation with them. So just ways you can kind of continue to stay social and use your voice. And then, as I mentioned before, finding a Parkinson's group can be really helpful. So on the WPA website, which I have listed there, there's a nice list of, I think it's under, support groups or exercise groups, and you can sort it by your location. So look up in your area what they offer near you. Where I work at Aurora Summit, we have group exercise classes where we work on voicing and we work on kind of the physical exercise as well. And then we also have a loud class, which is kind of more of a support group voicing exercise class. And we offer free screens so people can come in. We screen them and see what class they'd be appropriate for. And then most of the classes we have at the hospital are free. So people can just come and go to the classes. But like I said, look on this website to find if you can find some in your area if you don't live out there. And those can be a really great resource as well. And then talking to your doctor about getting an order for speech therapy. So it really is best to be, if you are having changes in your speech or your voice, best to be evaluated by a speech therapist. Everyone's different. There's these common changes that you notice or that are characteristics of speech and voice in Parkinson's disease, but no one person has the exact same things going on. Might be at a different level compared to someone else. So it's helpful to do the one-on-one therapy, especially with the cueing and things to be louder. Sometimes it can be hard to know, like, if I'm reading out loud, how loud do I need to be, and to do it without straining your voice and things like that. The other common thing that happens with Parkinson's is the perception of the voice being off. So there's that perception mismatch. So when someone, starts to have these changes in their voice and the voice gets quieter, they might not perceive that their voice has gotten quieter. So, loved one, family member might be the first to notice that your voice has changed and kind of point it out, and you might not notice it yourself, and that's actually part of the disease because the perception of how you're speaking and your actual voice output is off. So that's where that one-on-one therapy can also be really helpful, because we can kind of help essentially recalibrate your system to help understand, that you need to talk louder and feel like you're talking loud just to get to sort of a normal level. And so kind of doing that one-on-one therapy, and then we can individualize the goals for you as well. So if that's something that you feel like you'd want to do, you just have to get an order, usually from your neurologist, and ask if you can get a speech therapy consult. All right, so before we move on to the swallowing piece of the presentation, does anyone have any questions on any of the speech things that we just went over? I don't know. It goes through insurance. So yes, Medicare covers it. It just depends on insurance. And usually if someone is coming in for the program, the receptionists run it through the insurance before you come in so that you would know if you have a copay or not and before you come in for therapy. At Summit, they run every week, ongoing all year. Well, we have 3 different exercise groups at the hospital. We have 2 different exercise groups that we run through the YMCA, and then we have 1 group that's just that loud class at the hospital. So we have about 5 classes every week. Did you have a question? Thank you. Yeah, it can be really helpful. He said that he went through the LSVT loud program and that it was really helpful to see how loud he was speaking because he didn't realize that he wasn't talking loud enough. And basically, he would recommend it for everyone, even if you don't think that your voice has gotten quieter, that program can be helpful. So, did everyone hear? Oh, do you want? Yeah.
I went through the loud program, it worked, but the problem was I didn't continue what they taught me, my voice went again. So you have to keep it up every day.
Yep.
Could you say a little bit more about stuttering and how you can work on that?
So the stuttering can happen because of the difficulty with stopping movement. So when you get started on a word or a sound, such as maybe your tongue has to move up to make that sound, that your tongue won't stop moving. It's difficulty kind of stopping. So things that can be helpful are kind of pausing before you say something, thinking about what you want to say in your head before you say it, kind of slowing down, speaking with purpose and intent. So kind of when doing the loud program can sometimes help that, because we really make those purposeful kind of starting and stopping movements. But it can be a tricky thing to kind of remediate.
I would like to tell that you can buy DVDs for the LED speech. They are available. I think the DVDs run around $30 or so, but they're very, very helpful for practicing after you've had the class.
Yep, there's a homework helper DVD that is available that can help you keep up with the exercises after you're done. All right, is that it? Okay. All right, so we're going to move on then to kind of the swallowing portion of things. So, again, to kind of give you some medical terminology to familiarize yourself with. Dysphagia is the medical term used for difficulty with swallowing. And again, this doesn't only apply to Parkinson's disease. It can be anyone. Sometimes people might have difficulty swallowing from a brain injury, or it can happen with age. There's lots of different reasons, but it can happen as a result of Parkinson's disease. So it's any condition that affects the lips, mouth, tongue, throat, larynx, or your voice box, and esophagus that can cause dysphagia. People who have swallowing difficulty are at a risk for choking and aspiration. Aspiration is when food or liquid goes into the lungs instead of into the stomach, which can lead to aspiration pneumonia. If you have food or liquid that accumulates in your lungs, that can cause pneumonia. Dehydration, malnutrition. So those are the concerns kind of associated with this swallowing disorder. So I'm going to have everyone kind of do one more thing here. So I want everyone to swallow once, whether you want to take a drink of water or just do a kind of a dry swallow. And I want you to think about, again, how are your muscles moving when this action is happening? You might want to put your hand on your Adam's apple, kind of feel how your Adam's apple moves. And then think about how your tongue is moving. Think about what's happening with your breathing, and just kind of pay attention to the movements as you swallow. So swallowing is one of those things that I think we kind of take for granted. We don't really think about how it works or what's happening. It's just kind of something we do. But there's really a series of complex movements that are going on when we swallow. So you might have felt your Adam's apple kind of come up forward and down. As you swallow, your tongue comes back. It hits the kind of the back of your throat. As you swallow, you temporarily stop breathing. Your airway closes off when you swallow. So you might kind of take a breath in, swallow, and then exhale. So we're coordinating our breathing with our swallowing as well. So as you might imagine then, again, if there's breakdown in any of these muscle movements, weakness, reduced coordination, kind of slower movements, then we can have a breakdown in our swallow function. So common changes that we kind of talked about before with the speech as well, but common changes in the muscles used for swallowing with Parkinson's disease are that rigidity of the lips, tongue, and jaw, Slower movements, so people can have a delay in the initiation of swallowing, meaning that the liquid might be traveling down into your throat before you get a chance to trigger a swallow. Impaired chewing, and that's kind of that, again, reduced range of motion of the jaw and some weakness in those muscles we use for chewing. Reduced tongue strength, range of motion, so kind of being able to formulate, we call a bolus of food. So when you chew food really well and kind of mash it up and it kind of forms into a ball, you push it back in your mouth. People might not be able to form that bolus as well because of the difficulty chewing and difficulty kind of mashing things up. Smaller tongue movements. So instead of pushing the food to the back of your mouth and swallowing it kind of in one swallow, it might be a few tiny movements of the tongue, kind of pumping the tongue back to try to swallow things instead of that more efficient, swift movement. So that's the small swallows. Reduced strength of the muscles, and then you can have reduced sensation as well in the throat, which again can lead to that delay in that swallow initiation. It can also lead to, if you have food or liquid that maybe gets caught in your throat, you might not sense that it's there, that reduced sensation. And then the risk for aspiration into the lungs. So again, that's when something goes down, kind of that feeling like something goes down the wrong pipe, where that happens to every one of us every now and then. You feel like you swallow the water wrong and you cough and eyes might water. That's what aspiration is. If it happens every now and then, that can be normal. If it's happening all the time, that's a concern, and that's when it can lead to pneumonia. So this, you guys have a handout of kind of the signs and symptoms to watch out for. So things to keep in mind. If you haven't really noticed any trouble swallowing, or maybe you're not sure, here's some things that you can kind of just be aware of, some signs and symptoms of difficulty with swallowing. So coughing with swallowing, food left over in your mouth, gargly or wet voice quality. So if something goes, if you aspirate, something goes down the wrong pipe, goes into the airway, our vocal cords sit right there. So if you have, maybe a drink of water and that water is sitting on your vocal cords, when you go to speak, your voice might get that kind of gurgly, wet sound. So that's a sign that things might be going down the wrong pipe. Unexplained weight loss, meals taking a long time to complete, difficulty handling oral secretion, saliva, or drooling, changes in your breathing, so any changes in your breathing when you're swallowing or when you're eating, if you're getting really tired with eating and drinking, if chewing feels like it's really effortful. So to kind of touch on the sensation issues, the sensory loss that can happen, we call, if someone aspirates or food or liquid goes down the wrong pipe and they don't sense it and they're not coughing to try to clear it out or not having that cough response like most of us should have, we call that silent aspiration. And that can happen because of reduced sensation. This can be tricky because if someone is maybe drinking and silently aspirating, it might not be noticeable because they're not coughing when they're drinking, because they're not noticing that things are going down the wrong pipe. They don't have that cough response. So that is something that can happen with Parkinson's because of the reduced sensation. So negative impact of swallowing difficulty can be difficulty taking oral medication, which is obviously really important to be able to take medication, especially with Parkinson's disease. So that can be an issue. Difficulty maintaining your hydration, nutrition, And then, as I talked about before, the risk for aspiration pneumonia. So again, a speech therapist is the person who would treat swallowing disorders and Parkinson's. So if this is something you were concerned about, usually you'd be referred to a speech therapist. We usually do a video swallow study. So this is a video x-ray of the swallowing. It's done with a speech therapist and a radiologist. So we can actually observe how you're swallowing. We give you different consistencies of barium so we can see it on our machine and on the video. We can see how it's going down. We can see if things are getting stuck in your throat. We can see if you're aspirating, if things are going into the airway and into the lungs instead of the stomach. And we can assess how your muscles are moving for your swallowing, if your airway is closing off when you swallow, how it should. And then based on the results of that, we'll determine kind of the safest diet and then how we want to treat. So the EAT 10 is a rating scale that we sometimes use. You guys have a copy of this as well. Could be a helpful tool for you guys to look at and fill out to kind of see if you're having trouble with swallowing. So it's a rating scale. You rate yourself 0 to 4, 0 being that you have no problems, 4 being that it's a severe problem with swallowing, and then anything, if you add up your score at the end, 3 or greater is considered abnormal. Question? Sure. Yeah, I mean, mucus can be from, the nose, and everything's connected. So if you have drainage going back from your nose, you might have mucus. Sometimes our throat produces mucus. If there's irritants, you kind of get mucus in your throat. Versus saliva, our body kind of naturally produces. Saliva kind of helps break the food down. It helps us swallow it moistens the food when we swallow. All right. So diet modification is something that we might recommend depending on what we see on the video swallow study. So some different diet modifications that we might suggest are thickening liquids. We don't usually like to jump to this or do this long term. It's usually meant to be more of a short-term solution while you kind of do therapy and things like that to kind of help with the swallowing. So there's nectar thick liquids, honey thick liquids. Sometimes doing a thicker liquid can help only because, well, there's multiple reasons, but they move slower. So when you drink water, you drink normal liquids, they move pretty fast and it might spill in your throat before you swallow, kind of slide down into the airway, whereas a thicker liquid moves a little bit slower. It might help you sense it faster to swallow quicker, but doesn't always help, but it's an option. We might modify or recommend modifying your solid foods. So sometimes if people are having trouble chewing or things are getting stuck in the throat, we might suggest doing an easy chew or softer foods. There's different levels of diet modifications. Easy chew kind of goes in order from normal diet down to kind of the most restrictive. So easy chew, mechanical soft, those are kind of our just softer foods. Ground mince is where things are actually kind of ground up and chopped. And then pureed where everything actually goes into like a blender and it's kind of like the consistency of pudding. So depending on the severity of the swallowing difficulty, we might recommend some of these changes in the solid food. And then we can also recommend changes in how you take your medication to make it easier. So Sometimes taking it with applesauce or pudding can be helpful because sometimes people can have trouble with a pill and a sip of water and trying to kind of coordinate the two consistencies in their mouth. So putting it in to an applesauce can help it just kind of all go down in one kind of cohesive clump, essentially. Sometimes we might recommend cutting the pill and then putting it in the applesauce, or sometimes crushing the pills and putting it with the applesauce. There's different strategies we can also recommend to help with swallowing. These I would always want to see done on a video swallow study before recommending them because they don't always work. Sometimes one strategy that works for one person might make the swallowing worse in someone else. So we always kind of test how these strategies work on a video before recommending them, but these are just some different strategies that we might try or that might be helpful for people. So sometimes tucking the chin down can be helpful, turning the head, doing a hard swallow, double swallow, that's swallowing twice, or taking smaller sips. So the chin tuck can sometimes help people control the liquid in their mouth because gravity helps as you're tucking your chin down. It can also help with the contact of your the back of your tongue to your throat to kind of squeeze the food down. Turning your head sometimes can help open up the esophagus to allow the food to go down. Doing an effortful swallow, when we swallow hard, we're kind of squeezing the muscles in the back of the tongue and the back of the throat to kind of help push the food down. Double swallow, that might be if someone is having residual or leftover food or liquid in the throat. They might need to swallow 2 times to get it down instead of just swallowing once. Sometimes smaller single sips are helpful because taking maybe a large drink or kind of chugging those consecutive swallows might cause people more issues than if they just take kind of one controlled single sip. So in addition to maybe modifying diet, maybe trying some of these strategies while you're swallowing, there's also ways we can treat your swallowing to help improve your function of the muscles that we use for swallowing. So as we talked about before, the LSVT Loud program, there has been shown to be some improvement in swallowing with LSVT Loud. It's not something that we specifically target in the program. There's just kind of some overlap, again, with the muscles that we use for swallowing and speech that you might have some improvement if you do the program. So when we talk louder, we help with vocal cord closure, and that can help if your vocal cords are closing better, then that helps protect your airway. So when you swallow, it can kind of help close off the airway better so things don't, it protects things from going into the airway. I can improve your breath support, which, like I was saying before, we have to coordinate our breathing and our swallowing. We kind of inhale, swallow temporarily. We are not breathing, exhale. If that coordination of the breathing is off, that can also throw off the swallowing. So with improvements in breath support, that can help. You might have improvement in your pitch range through doing the Loud program, which can help with airway closure during swallowing. And then just general coordination of the muscles that we use for speech can also help then the coordination of those same muscles that we use for swallowing. So we wouldn't usually recommend LSVT Loud if swallowing is the only issue that you're having. It's not meant to replace traditional swallow therapy, but could be a good kind of adjunct to swallow therapy because there is some of that overlap. So kind of general swallow therapy we do is we can actually exercise those muscles that we use for swallowing. So just like in physical therapy, you can do arm exercises, you can do leg exercises to kind of strengthen the muscles and work on that range of motion. We have exercises that we can do for swallowing as well. These are just a few examples. But kind of depending on what we would see on your evaluation or on your video swallow study, we would determine what exercises that we would do with you. EMST is a really common thing we use in swallow therapy with Parkinson's disease. It's an expiratory muscle strength trainer. That is something that we might recommend for you. It helps to strengthen the muscles that we use to exhale, which can help produce a stronger cough to clear things that might have slipped into the airway. And it can also help to strengthen the muscles that close off the airway when we swallow. You guys should all have a handout of this. This is things that you can kind of start doing today if you're having trouble swallowing, just some tips for safe eating. Cutting food up into smaller pieces, taking small bites of food, chewing really well, so try not to swallow if your food is not fully chewed. Swallow everything in your mouth before you take another bite. Take your time with eating. Don't rush through your meal. Make sure you're sitting upright. Don't recline on the couch and have your snack. Try to make sure you're upright at a table, sitting upright. If you're feeling weaker or tired, it might not be the best time to eat. If you notice that you're having trouble swallowing or coughing a lot, clearing your throat a lot during the meal, it might be a good time to stop eating. And then talk to your doctor if you have concerns with your swallowing. They can recommend speech therapy evaluation, might do a video swallow study, depending on what we would see. We might recommend loud program, swallowing treatment, both, following the therapist's recommendations. Again, everyone's swallow is different, so not a one-size-fits-all treatment, and if you are having trouble, it's best to get it evaluated and kind of go from there. All right, and that is it. If anyone has any questions on the swallowing piece of it. Usually you'd have to be brought to a hospital or an outpatient facility to have the test done.
So how do you define coughing a lot versus once in a while? I mean, obviously every day with every meal is a lot, but where's the cutoff for you, like a red flag cutoff?
So, I mean, there's not really a specific number, but if you're just noticing increased coughing, like especially around mealtime, I would get it checked out or kind of monitor it. And there's not really, even if it's not all the time, it might be something that would be good to get checked out, especially with, as I was saying before, there can be that sensory loss and maybe not even always coughing when something's going down wrong. So it's good to get it looked at if there's a concern. Yeah, it can. Clearing throat, coughing can all be signs that maybe things are going kind of down the wrong pipe. So. All right, I think, are we out of time for questions? Okay. Well, I think we're out of time for questions. If anyone has individual questions, they can come up and ask me. I'll kind of hang out for a little bit afterwards. Thanks for coming.